Dr. Venkatesh, I am so excited to speak with you.
Nice to see you finally.
Dr. Venkatesh Movva is one of the top surgeons in the field of orthopedics, transforming lives through stem cell therapy. He has set a new standard in orthopedic excellence, helping thousands regain strength and mobility.
What is stem cells?
When we age, so you start wearing the joint. Now you have something your own body makes so you don't get old. That is called stem cells. You can actually save your adult stem cells.
How expensive is it? In IVF, they try creating an embryo in a lab. Now you're saying that created embryo have the capability of regenerating brain tissue, skin tissue, lung tissue?
Absolutely yes.
Wow.
But there is tremendous amount of ethical issues. So we have to tread this very carefully.
I think that stem cells, the pain levels are roughly bearable.
To be honest, a little bit more painful.
If our parents had chosen to save our umbilical cords, would our life be easier from a regenerative perspective later on?
It is good for some rare diseases. But now, most of our professional athletes, they save their cells. You've seen these footballers like the Ronaldos, Messis. How many years they've been playing? They've been playing for 20 years of football. You rarely see them going down for a year or two. The reason is all these guys have their cells stored. They literally hit these things every off-season.
I've noticed this with every single person I know, at least in India, goes about weight training, will have some random joint, muscle and bone problems.
What I see nowadays, the training methods in all the gyms are not medically appropriate.
Arthritis is one of the most common problems in India.
When you let a knee arthritis at stage 1 untreated, you will never have.
What? I've been reading about stem cells for years. By this point, I've spoken about stem cells often on the episode, but never spoken to someone who is actively using stem cells to improve the life of patients who require the benefits of stem cells. This episode is a deep dive into the practical usage of stem cells when it comes to orthopedics, but also a deep dive into the general understanding of stem cells. Trust me, if you're watching this in 2024, in about a decade's time, you will be in a situation where you might have to consider injecting stem cells into your body. That's how fast this field of medicine is growing. Doctors all over the world are learning more when it comes to stem cell research. This is one of the most in-depth conversations about this topic present on YouTube. I try to make it as practical and as friendly for the end consumer, which is you guys. This has been one of my favorite medical podcasts that we've ever created on TRS. It's Dr. Venkatesh Movva of Regen Clinics on TRS teaching us about stem cells. Super geeky, but also super enlightening topic about the future of the human body and the future of medicine. Enjoy today's episode. Dr. Venkatesh, I am so excited to speak with you. This particular topic is one of my absolute favorites, and we've done so many episodes on health and fitness, but this topic is something that the average person cares about usually only after the age of 25 or 30. Up till that age, you're just trying to figure out how to be fitter, how to be healthier, maybe.
Yeah.
But after 30, you have to care about regenerative medicine. Very, very important. I also feel that with someone like you, you work with way too many professional athletes. Those guys see regenerative medicine earlier in their lives. But this is something that needs to go out to the average person. So welcome to the studio.
Thank you, sir. Thank you. Nice to see you finally.
Yeah. Feeling all right?
Very good. Very good. Thank you. Nice atmosphere and good smell. Good, good vibes. Yeah.
Great guy.
Yeah. Already.
I wish to start at that point of regenerative medicine. The one word associated with it that most people know about is stem cells.
Right.
I would love for you to begin with a 101 on stem cells and how it may apply to all of us in the near future.
Okay. So stem cells is one of the big instruments where the regenerative medicine started with, because we didn't have regenerative medicine unless we're able to regenerate. So stem cells is one of the bigger instruments in that part.
What is regenerative medicine?
Yeah, regenerative medicine is basically, you can look at it like this. It's the opposite of degenerative. What is degenerative? So when we start wearing out, so as we age or an injury, so you start wearing the joint, you start wearing the cartilage, right? So you're losing, and your body's trying to make it. Sometimes it's hard to make it because some of these materials like your cartilage, ligament, tendon, do not have enough blood supply. So what happens? They continue to degenerate. So something that we can regenerate. So if we can regenerate that particular, say like the cartilage or a tendon or a ligament, that is called regeneration. So I'm talking about mostly the orthopedic, but regeneration could be anywhere in the body. So if you have a heart problem, lung problem, kidney problem, anything that can regenerate it, tissue that is naturally degenerating, is regenerative medicine. But how do we do it? We didn't know how to do it, right? I mean, when we had degeneration, we did a lot of modalities like, therapy, exercise. Then you ultimately went for surgery. But now you have a material, like 20, 30 years ago, we're able to figure out, hey, we have something our own body makes these regenerative material, because we are healing in most of the other areas. We are healing with our own stem cells, right?
But the human body is built to degenerate over time.
Yes.
That is what the process of aging is.
Exactly.
Now, if you get a really bad cartilage injury, like I've had a knee injury lately, which I was telling you about, an ACL tear.
Yeah.
We see so many back injuries in cricket. We see so many leg injuries, hip injuries in football.
Yes.
All those things accelerate your degeneration of those parts if you leave them injured.
Correct. Yeah.
And stem cells are one of the means to help regenerate those parts of your body if you're injured. But in the long term, I believe stem cell research is going towards overall regeneration of your body.
That's true. Because when we talk about orthopedic conditions, this research has been significantly long enough. So I would say 25, 30 years ago, all athletes have been trying. So it's already in clinical usage. For example, now the common person, like everybody, we can use it because the research started then. We have gotten enough data, enough confidence, enough results so that we're able to use it. The other fields, for example, we're talking about, maybe neurology, cardiology, other pulmonology diseases. Research is still happening. And there is tremendous promise that stem cells can do wonders, but we have to wait till we prove it. So I cannot say hey, I'm going to treat this without a proof behind it. So we have to substantiate what we are talking about. Particularly, it's a new field, so there's a lot of responsibility for us to prove that.
Got it. So with stem cell use, when it comes to orthopedic issues like your bone and cartilage, there's a lot of research. It's tried and tested. It's safe. But as for using stem cells for the brain, the heart, the lungs, the research is still on. It looks promising.
Yeah.
Before I ask you much more about the orthopedic side, how far are we in terms of time from the point where we can use it to regenerate our brains, our lungs, our hearts?
Yeah. So it is actually tested in clinical studies. When I say clinical studies, is on actual human beings. So if you look at multiple universities in US, where I am, almost every big university has a research study. Somebody is studying on stroke, somebody is studying on diabetes, somebody is studying on regrowing the cardiac muscle tissue. So there are studies going on. These are human subjects that are actually getting it done. Just like, when we approve it, it has to go through, phase 1, 2, 3. So that's the kind of studies that's going on. And outside US, because US has regulations like FDA regulations, so you cannot offer a treatment unless you prove it enough. But outside US, some countries offer these as treatments as well. But again, that's depending on the country's regulations. But if you ask me, what is the overall, I would say orthopedics has been done for 25, 30 years clinically, and other fields are coming.
Got it.
They're coming. Yeah.
Okay. I know one of the countries is Panama, right?
Yeah. Panama is one of the big ones. Yeah. You probably heard all the big celebrities go there. Chris Hemsworth and Mel Gibson, all these guys. We go to one of our facilities back in Panama. Yeah.
Okay. Even you have a facility in Panama?
No. We have one in Cayman Islands, where
Okay.
the reason the difference is in U.S. and India, we can use your own stem cells, like we call it. We extract from the bone marrow, but the rules say I have to give it back to you on the same day.
Oh.
So we cannot store or culture or grow them because, as I said, it has to be done responsibly. Because if you let everybody do it, there could be some bad actors in doing all. So it's good to have regulations. So all these big countries have good regulations. So we'll do it as the time comes. So same day. That means we extract your bone marrow, take the cells, inject it, plenty of cells. Good. That's accepted. That's within the guidelines.
Okay.
Where when you go to Panama or when you go to Cayman Islands, what happens is they make their own rules. So as long as we show the safety, compliance, all those, they allow you. See, most of our professional athletes, they save their cells. For example, if I take cells from you, not only I'm treating you today or tomorrow, you can actually save the cells, your adult stem cells, and keep them there for 10, 20, 30 years. So you get old, but your cells don't get old, and you can actually grow them and use it for multiple purposes. We're talking only orthopedic wise. There are conditions that are treated non-orthopedic also in these countries. But as I said, let's not jump the gun and say it works for everything. It is heavily promising. It will come into acceptance and FDA approvals even for other conditions as well.
Got it. What are stem cells? Because all I know about it is that when a baby is born, it has an umbilical cord which eventually falls out.
Yeah.
But the umbilical cord is supposed to be a hotbed of stem cells.
Correct. Yeah.
Also, stem cells are produced within your own body, inside the bone marrow.
Correct. So stem cells come from multiple sources. Yeah. So the umbilical cord you're talking about is one source, placenta, the bone marrow, the fat. So these are all areas where your stem cells are produced. But as we become our age, for example, we can only take it from a viable source like your bone marrow or your fat. And these are called adult stem cells, also called mesenchymal stem cells. These stem cells do not have the potential to turn into every tissue, contrary to popular belief. A lot of people think like, oh, I got stem cells, I can do everything. I can grow my skin, I can grow my hair, I can grow my organs. That is not true. So these adult stem cells, mesenchymal stem cells, used mainly for the similar fields like tendon, ligament, cartilage, bone, muscles, because these help with the musculoskeletal conversion.
You're saying the stem cells that you extract from your bone marrow are only used in kind of the skeletal system, the muscular system.
Exactly, because that's the subsection. Say like if there's a technology that will extract stem cells from the skin, we don't have that. That will be used for the skin-related. So they only work selectively, but still they can convert into these 4 or 5 tissues, which is helpful in regeneration of that tissue. Because most of these tissues are fibrous in nature, so these things help form that tissue back. The other stem cells you're talking about, like umbilical cord, that is not, we cannot take it because we're already grown up. There is a structure from umbilical cord that you can extract, save him, like you see the blood banks. That's done for different purposes. That's for like if the baby needs something in the future, if there's any life-threatening disorders or like a rare disorder, they can use the cells back into that condition.
Suppose for all of us, if our parents had chosen to save our umbilical cords,
Yeah.
would our life be easier from a regenerative perspective later on?
That's a good point, because we all went through that phase like, oh, we need to save our babies things. It is good for some rare diseases.
Okay.
But now we have the technology. Doesn't matter how old you are, we can still extract some of your cells. So the usage for absolutely necessity probably not as much, but it is safe to have just a mental peace for the parents. Hey, if something weird happens, I cannot find a donor somewhere, at least I have these cells, or if these cells can be used for somebody who is suffering in the family. So it's good to have it, but obviously the technology has gone so much now. We really don't need baby cells when the baby were born to treat the baby's musculoskeletal system later, because we can extract now.
Got it.
Yeah.
Okay. Before I let you move forward,
Yeah.
thank you for coming into our lives. I've been waiting for this podcast for ages.
Yeah.
This is one of my favorite conversations from a
Yeah.
biology perspective,
Yeah.
because I feel like biotechnology is advancing very fast.
Yeah.
And we talk about AI, we talk about virtual reality, we don't
Yeah.
talk about these things enough.
Yeah. So we were talking about adult stem cells, like what they can convert, right? So there's a lot of people say, like, what about embryonic stem cells? So embryonic is different. Embryonic means like when the baby is about to be born, embryo, at the embryo stage.
Before the baby is formed.
Before it's born. Those cells are different. Embryonic cells, they're called pluripotent. That means multiple. Those cells have the capability of hopefully forming your lung tissue, your brain tissue. They can convert into any tissue. But adult stem cells, like when we are born, our tissues do not convert into other tissues, basically. You have to take it from a certain body part and put it in certain body part. Embryonic can be done that, but there is tremendous amount of ethical issues.
Right.
How are you going to extract the embryo? But there are some consented mothers, there are some ethical issues. So that's why it's kind of prohibited in most of the well-controlled, environmentally controlled countries. But that is also in existence in some countries. So we have to tread this very carefully.
Wow.
Yeah.
Okay, let me break down what you said a little bit.
Yeah.
When you said embryonic, it basically means like when a sperm meets an ovum, an embryo is formed, right?
Mm-hmm.
In IVF, they basically, in some processes within IVF, they try creating an embryo in a lab. Now you're saying that created embryo can be used for stem cell extraction because it's a hotbed of stem cells.
Mm-hmm.
And those embryonic stem cells have the capability of possibly regenerating all the tissues in your body, brain tissue, skin tissue, lung tissue, what have you. That's what you're saying?
Yeah, potentially, because those tissues are very undifferentiated. That means they do not have a character where they're going to belong. So it has been done, as I said, not in US, not in India, but it has been done in other countries. But there's multiple issues involved with that thing. How are you going to extract? So there is a tremendous amount of ethical and the research issues still we need to, but theoretically speaking, absolutely yes. Not only theoretically, it's been practically done in multiple countries as well.
I see the ethical issue with it because you're basically creating a precursor to a human being,
Yeah.
placing it in a laboratory and then extracting from that precursor to the human being.
Yeah.
But can you extract stem cells from the embryo and then still allow the embryo to form inside a uterus and become a human?
No.
So you're killing
you
that.
you can only, that is the problem. Yeah. So that's the ethical issue, basically.
Wow.
Yeah.
But there are mothers and fathers all over the world who are willing to...
Well, I mean, not, as I said, like in some countries, could be any reason though. So maybe a voluntary issue or a health issue, they have to abortion, whatever they need to do. Those scenarios, you see it. That's why you would not see it in a well-developed country. You will not see that thing. But as a research, it's been going on in multiple countries as well. So just to bypass, like, okay, there's a lot of ethical issues. So what the technology is doing now, I mean, for a while is, hey, can we take an adult stem cell, like yours and mine's, which is multipotent, not pluripotent. Multi means, it can turn into tendon, cartilage, ligament, but it will not turn into other tissues. So can we take that? Can we genetically program that? So they called iPSCs in a lab, and that's been done as well to make a regular cell to become a pluripotent, where in the future, if you want to create some healing of the heart, lungs, we want to create a tissue, that can be done. That's going on. We're talking future and present but not clinically used. These are all lab. I'm just giving you like what's going on. So this way there is no ethical dilemma because you're not taking it from a baby, but you're converting a cell. But how do we know if that cell, will it become a cancer cell later? Will it cause tumor? We have no idea. But these are all happening right now.
Got it. Because you're someone who's in the center of this industry, studying it, applying it. The question I have for you is about the future again.
Yeah.
Would you say that we're 10 years away from that possibility where you're taking a multipotent cell and turning it into a pluripotent cell?
As I said, there are a lot of negative things that can happen. We would rather be very careful, understand the whole thing behind it. Right now, I don't think we have enough understanding what the long-term effects of doing this thing. For example, if you do that implant in somebody, what will happen 5 years, 10 years down the lane? Will it turn into something? That we're still skeptical. So I think it will take much longer than that. But what we know is autologous. Like that means I take your own cells, put it in your body. There is zero risk. That we know. That's the reason we're doing these things right now, because your body will accept your own cells. But we don't know how an external source will ever function in you. So I would say we're not there yet, but research is happening.
It's like when you have a kidney transplant, sometimes you have to wait for the receiver's body to accept the organ. Right? Same logic.
Yes.
That when you take someone else's stem cells and put them in your body, may or may not work.
Exactly.
But we know that if you take the stem cells from my body and put it inside my body, it does work.
Right.
For certain applications.
Exactly. And also we don't need to do any immunosuppression or do anything, prepare you, because your body, you already have these things in your own body, and they're taking it and putting it back in the same body. So you'll have zero issues with the rejection, incompatibility, or any of those natures. Yeah.
Okay. We've done so many podcasts up till this point that I have some understanding from different people.
No, great. Even though I'm not the researcher of the stem cells, I'm more like a clinician with orthopedic stem cells. But this is all we imbibe in. This is so exciting for us. There's so many possibilities that we know clinically what we can do, particularly in orthopedic world, and that we're already doing what we couldn't do 10 years ago. And I can only imagine what we can do in the next 5-10 years. Yeah.
Okay. I have a very rookie question for you. A stem cell, a single stem cell, is a unicellular organism, right?
Yes.
Now, all of us had that chapter of cells in biology.
Okay.
That's how non-medicos understand cells. What's special inside a stem cell that allows it to become a tissue cell as it collects with other stem cells? Is there like a special device inside that cell?
Cell that's differentiated, that means we have cells everywhere, right? So if a cell in the labrum or in your ACL, it's already differentiated. That means it's already an ACL fibrous tissue. So that's not going to do much. That's not going to change much. Whereas a cell from a bone marrow, it's called a progenitor cell. That means it's not formed fully into a function. So those cells, for example, you take him and put him in a medium, say like you put him in a cartilage. If somebody has a meniscus tear, we put it inside the meniscus. So the signals, and you have growth factors around it, they can convert that cell into that particular tissue, like a fibrous tissue, cartilage tissue. You put it in a ligament. Now, ligament structure is a little different than a cartilage, but still everything is a soft tissue. So they can potentially convert into those cells. So these things are environment dependent and the stimulation dependent. So our body stimulates these cells to transform into those cells.
Got it.
So that's how they differentiate.
They have some kind of morphing device inside them. That's how I look at it.
Correct.
Potential to grow into anything, depending on the position that you place them in. The surrounding region contains growth factors that triggers the potential to make it grow into that particular body part.
Right. And sometimes we have to supplement the growth factors along with the stem cells. For example, you have a lot of environments, like if I take a disc, for example,
Spinal
disc, very common, right? Like we sit, a lot of sitting people have the disc degeneration. So what happens once you start losing the disc height, why does it not grow back? See, if you cut the skin, it grows back. If you break the bone, it grows back. Why? Because you have tremendous amount of stem cells inside the bone. The skin has so much blood supply, we grow. But once you cut the disc or cartilage, why does not it grow back? Because you don't have enough blood supply originally. But whatever blood supply, if you lose it, and it's struggling to grow. And also the environment inside. So it is not oxygenated, for example. It's called hypoxic environment.
You're talking about the spine.
From the disc part of it. Let's say disc, for example. So that's why it's degenerating. So when we put the stem cells alone, you always have to put the other things. When you put the seeds, like stem cells, you have to put fertilizer with it. And those are your growth factors and cytokines. And we can extract that at the same time along with the stem cells, or you can extract them from your own blood. So you have to activate the stem cells when you put it in. And that's how they work together.
Wow.
Yeah.
Okay. I have too many tangential questions, but you're basically saying that, especially when it comes to the spine, all of us who go to the office, who have sitting jobs, we will get some form of spinal issues at some point if we don't do something about it. Assume that we all will. So you're saying that the spine doesn't have enough blood supply and it doesn't have enough oxygenation. Therefore, you, the doctor, has to assist that process of regeneration when you're dealing with the spine.
Particularly the disc structures in the spine.
Got it.
Yes.
Okay.
Yeah.
Now, say hypothetically, I get a cut on my arm. Now, when that cut starts healing, are stem cells at play?
Yeah. So if it's a superficial cut, right, your platelets are coming in. Just the platelet growth factors are good enough to kill. But if you have a tissue cut, for example, if a tendon is cut, it's a deeper muscle is cut, then your own stem cells and the local stem cells are going in and healing that part of it.
Got it.
But when you cut a tissue that does not have enough blood supply or stem cells, which are all our soft tissues, like tendons, ligaments, cartilage, all our joints, once you cut it, they don't heal well. I mean, not only like an old person, even a 15-year-old kid comes with a sports injury, right? He cuts the meniscus or he cuts the labrum. He cannot heal, even though he's only 15.
Oh my God.
So it's nothing related to the age. That structure is not conducive to heal by itself. So what do? Hey, let's recognize it. Let's heal it. Let's do with the minimally, invasive procedure. Put it in there, heal that thing, and you're back on track. Okay. So that's the idea of doing this field, basically, to get him early, catch him early, heal that thing, so you maintain your biological structure and get back into your daily activities.
Got it. Are there animals in the animal kingdom that have an excess of stem cells as compared to other animals?
I'm not sure if they have excess. We have noticed, like there's something called a salamander. It's it's like a lizard only, and that has a tremendous capability. We have enough evidence, like where you cut an organ, like for example, you cut the tail of salamander, it has the capability of growing back it. So there are few animals of that nature in the wild as well. We see that thing. So, but again, I'm not sure how we can relate that, but we know it's a self-regenerating mechanism, and that's the same thing we're trying to do with the help of with the physicians rather than naturally growing. I don't think humans have the capability of naturally regrowing. If you lose a finger, it's not going to come back. So yes, some animals have that inherent capacity.
Okay, gotcha. Second tangential question. And I think this applies a lot to the average person. Because for someone like me who's played sports, who's dealt with sports injuries, I'm dealing with probably the worst sports injury of my life right now with the ACL tear. But I've had tiny niggles in the past. I've had a tennis elbow, etc. So I'd categorize the modern day healthy human into 3 categories. Someone who has a bad sports injury.
Yeah.
Someone who'll get that generic sports injury, if you keep lifting weights, at some point, something is going to happen. It's
Right.
just the nature of lifting weights, even if you have the perfect form, etc. It's just how weight training works.
Yeah.
You agree as a doctor?
Yeah. But again, there could be bad weight training. There
Yeah.
could be good weight training, injury-prone weight training. Yes, you're right. You're risking if you're not doing it properly.
Yeah.
Yeah.
I've noticed this with every single person I know, at least in India,
Yeah.
who goes about weight training. And I love weight training. I'm a big proponent of it.
Yeah.
But sometimes over the course of like decades of weight training, sometimes you just miss out on some nuance.
Yeah.
Which is why everyone in my city needs a physio.
Yeah.
Anyone who's fit needs a physio
Yeah.
in today's day and age. So this is my second category. That someone who's just fit
Yeah.
will have some small niggle. It's just the side effect of being fit. The third category is just the average person.
Yeah.
Say who's just doing basic, strength training, little bit of calisthenics, little bit of yoga, and is staying,
Walking.
yeah, just the normal, kind of what our parents' generation does.
Exactly. Yeah.
I'd also keep a fourth category of like a bad lifestyle, someone who's overweight, someone who's not taking care of themselves.
Still young. Yeah.
Yeah, but still young.
Still young.
And there's a lot of that in our country as well.
Yeah.
So 4 categories of human beings.
Yeah.
Will all these 4 categories be assisted by stem cells when it comes to the quality of their life? Because we're living in an age where we sit so much, where we're not nomadic anymore, we're not walking around,
Exactly.
we're not that active.
Yeah.
I think we are going to develop hip issues, knee issues, and spine issues as a generation. Have I said something wrong, medically speaking?
No. Actually, that was one of the best questions. The reason is you kind of covered the whole spectrum. So I can talk a lot about it, because a lot of people have the same thing. Like, who does it work on? How does it work? Is it only on sports people? Is it not on old people? But the way you categorize, like, how we live our lives, basically. So let's take the first spectrum. The first spectrum is like elite athletes. We'll just say like somebody's elite athlete. Professional sports, or cricketers, or any other sports, football, basketball. So they cannot afford to be down. Say, like, if you're playing for India, you're playing for some, your injury has to heal. That's money for them. I mean, that's money for the country, money for everything. So the urgency to get better is so much in there. So there is an injury. They are not going to wait 10 days, 2 weeks, 2 months and find out what it is. You want to diagnose them right away. So a lot of times, if it's not a catastrophic injury, it's a good early injury. So most of the athletes come with like, hey, I have a tear, or I broke this thing, or my meniscus has been done. Or some could be chronic, when they keep on playing, they could have like chronic injuries of something, and it can come up. So those are the patients that we look at them, look at their MRI scan, see what's going on. Okay, you have a partial tear of something. We're talking about a cartilage, ligament, tendon, whatever it is, your knee, shoulder, any joint, depending on your sport, right? Okay, you're not fully torn. You do not need surgery, but you need to get better. If you don't need to get better, how are you going to go back and play? Rehab is not going to help by itself, because you have to heal that. That's one category. So what we do is we diagnose them, and we aspirate their bone marrow. We take the cells. We precisely, with the guidance, it's called intervention, not surgical orthopedics. It's interventional orthopedics. So we go with an intervention with a needle-based technology. We have some machines called ultrasounds and fluoroscopies. You get look into those things, inject those areas, and give him certain amount of rest and get him back into the rehab. This is much shorter compared to if you have an invasive surgery. Invasive surgery may put you out for several months. With an interventional procedure, you're not cutting, you're not taking any tissue, you're only enhancing, you're only regenerating. So their rehab time, their recovery time is cut in short, and they're able to avoid any major surgery. Plus, they can maintain their own body. So that's the sports people. They come in, we treat them at an early stage, they're good, they go back. Then the next category is like somebody like who sits but young, but his job or his work related is creating those problems. For example, most of our IT professionals we're sitting 8-9 hours and working most of the time.
I think it's all professionals
yeah,
in
yeah,
modern
yeah,
day
yeah,
India,
yeah,
sir.
yeah. Not only professionals. I mean, like, a lot of jobs that require sitting. I mean, like anything. So what does sitting do? I mean, sitting is literally, I'm sitting right now. It's lowering my intradiscal pressure. So my discs are like cushions, right? That's the one that's going to, get me support off my spine. So you're sitting, and I'm sitting for that long. So I'm kind of lowering my intradiscal pressure. So
Even if I keep my back straight, I'm still loading it.
it will help, but it's not when you sit like that. You got to have the muscle strength to hold those things.
Got it.
How long can you sit like this when you don't have the muscle strength? So you got to work on your muscle strength, get a good posture, obviously get the good chair, good lumbar support. But sitting in general as creates that part of it, right? Lying down is great for the discs, great for the hips, but we can't lie down all our life. We have to come back and work, right? So that category is like, okay, more, we call that a deconditioning. And like, hey, I mean, I'm not in injury, I'm not playing sport, but I have this hip pain, I have this back pain, I have this neck pain, I'm on the computer all the time. Some people get these CMC joints, textures, arthritic changes, carpal tunnels. So knee problems because you're sitting all the time and you're not stretching it. So all these are chronic and they can build up on you. And on top of it, for example, if you're not doing your exercises beyond, after the work, you're not taking care of your muscle tone, you're not hydrating yourself, you're not eating healthy food to recover, your problem can accelerate. And you can see a lot of these young people like, oh, I can't sit, my back is hurting a lot. I can't drive because I can't bend. So there's no injury or an accident that happened. This is chronic lifestyle created. So these patients have to be recognized at an early stage. So we have to find out, okay, what is going on? Say like you're having back pain, right? Is it a damaged disc? Or is it just a posture, weakness of the muscles, or you have facets and ligaments and all those? So by an examination, you'll be able to tell. Somebody has no problem with the disc, but they have zero muscle strength and they kind of slouch, they have no core strength. So recognizing is one thing. So correction, lifestyle changes, number one thing. Number two is you have early warning signs. Hey, you're wearing out a little bit of the disc here. You're wearing out the labrum here because you're losing some of the cartilage there. So now, okay, can we repair that? Let's go repair that thing. And then you exercise. Then you avoid that posture and build the strength on your core. So all those can be done at early stage. So it's not only professional athletes, but regular guys like you and me do. The other category is like people that go to the gym, lift heavy, good, all good, right? It's all good. But what I see, I'm not saying in India, but what I see nowadays is the training methods are not medically appropriate in, I won't say all the gyms, most of the gyms. Because the culture is like, oh, I want to get six-pack. I want to look great. I want to get this thing in 3 months. But how are you training? Are you training the proper way? Are you lifting exercises? Are you doing overheads? Are you creating damage to your rotator cuff? These are certain techniques we'd say never do it. For example, a military press is no more. I mean, the last 4 years, we have noticed more people, creating tears in the rotator cuff. We cannot do that.
Just like you're talking about an overhead press?
Overhead weighted military press, or even abdominal crunches, right? I go to the gym, I see like everybody doing abdominal crunches. Trainers are making them do those things. We have seen people that bulge their discs. So there are modifications you got to do. You got to see like, okay, you cannot do that. Maybe do a plank or bridge, those kind of things. So overuse injuries in the gym or improper training, they can create damage. Sometimes you don't have to tear something, but your body will give you warning signs. So your body tells like, okay, I've been working out. Man, I'm getting a little stiff in here. Okay, stiffness is gone. Tomorrow I'm fine. I'm going back again. Again, I'm getting a stiffness. So you see a pattern going. Don't ignore that. Let's catch it early. You could have a ligamentous laxity, like your joint. Maybe it's like a rubber band stretching. That means you are going to have a tear in there. You're going to damage that thing. You're still working on it. So that's the category that we want to know proactively. Okay, I am doing certain things, but it's giving me some problem. But the problem is not there all the time. Then I'm going back to work. I'm fine. I'm ignoring it month by month by month. Or stop doing that exercise so that you don't have pain. But those are the ones we want to recognize early. This is called the proactive way. So anything, if a walker is having some pain in the knee, or somebody is going up and down stairs having pain, but no pain walking straight, and if it's happening, that means there's something going on. That means there's a little bit of a thinning of the cartilage or tracking of the kneecap. Something is going on, right? We got to identify that thing. If you identify, treat that thing either with the physical therapy or with the biologics. It could be PRP, it could be stem cells, or sometimes it could be just growth factors. But we recognize, you treat that thing, you're back on track, you're enjoying your life. You're not letting this go to the end stage. When you let a knee arthritis or something at stage 1 and treat it, you will never have stage 4. You will never need a knee replacement. So that's what happens culturally, like, oh, I will go when the pain is bad. Pain is not that bad. So what happens 3, 4, 5, 6 years, you're limping, your life is all gone. Then you try to go to a doctor. Then you can't regenerate when it's that far gone. So that's one category that we treat as well, proactively.
Most important sentence from this entire episode has just been spoken by you. You said that when there's a little pain, do not ignore it.
Exactly. Yeah.
I think we tend to ignore it when we're teenagers and in our early 20s because the body's regenerating so much.
Yeah.
But everyone around me after the age of 25 who's healthy has some niggle.
Yeah.
A lot of the ones who don't do any physical activity have a lot of niggles.
Exactly.
And all these little pieces of pain inside your body are just early signs for some big explosion that's going to take place later.
Exactly. Yeah.
Fair to say?
Yeah. No, so when you have like a warning sign like that and it's consistent,
Right.
so like it's getting, a little intense or staying there, that means there is something beyond a small sprain. So you need to be checked up.
Gotcha.
Simple as that. You can still, if you want to really enjoy lifting weights, hey, continue that all your life, but let's take care of it. Let's correct it. Then you can do that thing. Imagine if you tear it fully, you can never go back to the gym again. So that thought process. So that's another population. The last population is already there. For example, we see a lot of women, men, like arthritis. Say I'm suffering with arthritis for 5 years, 6 years. So we see that kind of population as well. That's already by the time we see the knees, knees are getting bone on bone. So kind of already very advanced arthritis. So you can't prevent it any further, but the goal is to maintain them. Hey, can we maintain your lifestyle? Can we improve it? Maybe if not 100%, can we get to 70, 80%? An older individual like, mom, grandmom, whoever, say like, they're happy if they get 70, 80%, they can live their life, sleep and do all those things. That's another population that also gets treatments as well. When it goes to the stage where it's too far gone, like for example, you mentioned you had an ACL tear. Yours was a partial tear. You're still functioning. But the risk is you may do this if something goes wrong. You're doing your rehab. That can be treated with biologic stem cells and you can get back on track and enjoy your life. If somebody comes with a full tear, they have to go for surgery. So there is a role for orthopedic surgery when you have a late stage or severely damaged joint, you go for surgery.
Yeah.
You do rehab at early stages, but in between stages is where we really didn't have much of a treatment until the regenerative medicine came in. Before that, we were like, okay, what do we need to do? Do some physical therapy, exercise, cut down your lifestyle. When it gets to the point like, oh, I can't handle it, you go for surgery. Yeah. So now we have this majority of the people fall into this category where you heal him, you get him back on track, you start enjoying your life, you will never be deconditioned after.
Got it. I have to mention something for all audiences. It's a bit of life advice that my life has taught me. I was a judoka when I was a teenager. Had some bad shoulder injuries on both my shoulders. rotator cuff stone before the age of 16.
Wow.
So my first surgery in my life was when I was 15 or 16 years old. Second surgery was when I was 17 years old.
Okay.
And they were on either of my rotator cuffs because I started getting problems. Like it would just get dislocated by itself.
Wow. Okay.
I think those were pretty bad tears. And perhaps the surgery was justified in those cases. But I think that with a lot of these bad injuries that one gets in sports, you really have to gauge how bad the tear is and don't immediately jump into getting a surgery. Because I feel it is a very long process when it comes to recovery. Like I think my shoulders have gotten okay only now and I'm 31 years old.
Right.
You know, years of physio, years of weight training, years of yoga finally fixed it.
Right.
So I feel really bad about getting the surgery even if I needed it back then.
Yeah.
Also, we have technologies like stem cells in the modern day.
Yeah.
We have better and better physiotherapy access in India
Modalities,
as well.
yeah.
Go to a great sports physio. Don't jump into getting a surgery immediately.
Exactly. Yeah. You have a lot of wellness modalities, treatment modalities. Physical therapists are, excellent these days, and they can get you back into the right mechanics. So definitely, if you can avoid, you avoid the surgery. Now you have reason to avoid, and you have things that can easily heal it.
Yeah.
So that's the first line of treatment anyhow. Only in a situation where you're refractory to all these things or it's a complete tear, then you would need surgery.
Like my ACL tear, I think it's a grade 2 or grade 3. There's 4 grades. 4 is like completely torn.
Yes.
Grade 1 is a tiny tear. Mine was 2.
Right.
There was a lot of people who suggested surgery.
Yeah.
Like the first impulse was, oh shit, you tore your ACL, you have to get a surgery.
Yeah.
So that first couple of weeks of tearing my ACL was psychologically annoying for me.
Exactly.
Like, why should I get a surgery so fast?
Yeah.
Let me see what's happening. I'm fine right now. I'm getting better gradually.
Yeah.
I'm coming to your office tomorrow.
Yeah, absolutely. There's a reason for that. So, a big guy like you get the recommendation of surgery. Imagine anybody can. So why that recommendation has been given to you, surgery? Because number one, India as we are a surgery oriented. People think orthopedics means surgery, right? That's all. Orthopedic means surgery. So, and it's heavily surgery focused nation because we do more orthopedic surgeries than orthopedic treatments. Like in Western world, like in US, there was a lot of surgeries 10, 15 years ago. But if you look at the last 10, 15 years, there's a lot of regenerative procedures and less surgeries. Surgery is always the last resort. So it is normal to get a recommendation because when somebody does surgery all the time, we used to do surgery for that. Okay, let's go do surgery. But the newer technologies like what we're talking are coming in now, and there are not enough experts that can do it, like the interventional orthopedics. I think it will change. I think it will change because more and more guys like me, incorporating this, people know like where to go and where to get it done. But now it's lack of choices. They feel like, okay, when you go to a surgeon, okay, let's do surgery because there's nothing else, they think. But if there's a specialist that can do, biologics like what we do, people will, that shift will happen. And orthopedics also will accept that because for the betterment of the patient, hey, when you don't need surgery unnecessarily, you don't need it. When you're stage 4, yes, I would do surgery. So that's happening. We're at the loggerheads of that junction of that transition of the orthopedics right now.
Yeah. Okay. Now we gotta talk about some practical questions related to stem cell therapy.
Yes, sir.
So say if I come to your clinic, right now I have an ACL injury, but I think a common injury would be like an elbow thing. What's the most common injury you see?
I would say most common is the knee. Knee arthritis, wear and tear, meniscus, cartilage, old age kind of thing. That's number one. Not only here, even in US too. I would say if I see 10 patients, 5, 6 of them are there.
Okay.
Then comes the sports injuries for the ACLs, labrum, disc injuries. Disc is very common as well.
Okay. What would be your procedure from start to finish? I'd also love to know kind of like a cost spectrum.
Sure. So we'll go with the procedure first. Yeah. So in India and in US, as I said, the regulations allow us to do our own cells. And we're also comfortable doing our own cells, right? Like we don't want to use somebody else's.
No, but in all cases, you begin with stem cell therapy?
No. It depends on your condition. So once we see any kind of tear, degeneration, cartilage loss, arthritis, then you advance to stem cells because stem cells have the potential to actually regenerate, thicken the tissue, right? When there is just inflammation, say like you come with the golfer's elbow, tennis elbow, and little sciatica, tendonitis. So these are called tendonitis, tendinosis. That means they're inflammation of the joints. You can have sprained shoulder. So these are not damaged yet, but they're either stretched or inflamed or an injury, right? You do not need stem cells there, or bone marrow stem cells, we call it. The reason is you're not trying to repair anything there. You want to clean up the inflammation part. So we use blood-derived platelets. It's called high concentration of platelets. You might have heard about PRP as well. So PRP is a low concentration, but the high concentration platelets, we get it from the blood. So that's good enough. So not everyone that's needing a treatment needs stem cells from the bone marrow. So you can do platelet-rich plasmas, sometimes even prolotherapy, simple, saline injection into taking the adhesions and scar tissue away. That's also helpful.
So say someone needs some help with stem cells for the arthritis or the ACL or rotator cuff tear.
Right.
What's your process as a doctor?
Yeah. So as I said, we use that person's own stem cells. And the source of stem cells is that person's own bone marrow. So with the bone marrow, we get stem cells, growth factors, and other good material with it. So it's called bone marrow aspirate. So that is what allowed by the government of India for us to aspirate. You cannot just take only stem cells and grow them, which we cannot do. So you're getting stem cells from your bone marrow. So per se, conversation's sake, I say BMAC, bone marrow aspirate concentrate, or stem cells. They're pretty much the same.
Okay.
So the process would be, say like you're coming, example, you have an injury, right? You're coming. So we determine you're a candidate. So I looked at your MRI, I examined you, and I feel like it's a partial tear. You have a great chance of healing and getting back on track. So you're a candidate. So the process would be me aspirating the cells from you first. So you come in, hydrate yourself. We prepare you for that thing. And you lie down on a table. There'll be a camera on top. And we numb it up here called iliac crest, this hip bone. A lot of people think it's the backbone. It's nothing to do with your spine at all. It's this hip bone. So we numb it up. Once we numb it, we put a small needle through the bone marrow. Sounds like painful, but it is not.
The needle goes through the bone?
Through the bone, yeah. Right. Even though it's a bone, it's like a really soft, spongy type structure right there.
Got it.
And that's the safest area. The reason why we go there, because there's no vital organs. You don't have blood vessels. You don't have nothing. It's the easiest, and that's the biggest reservoir in our body for stem cells. Yeah. We have stem cells in every bone, right? But it's hard to get to these bones. So you take it from there. It's people may worry about the name of it, but it's actually, I would say, a discomfort. Majority of the people say like, oh, that's it.
So you're saying there's almost no pain, but there's little discomfort.
Discomfort, yeah. Just like, when you put a needle, discomfort, but that's all. There's no major pain or anything.
Could you compare it to a run-of-the-mill injection?
Yeah, so it's like if you get a flu shot, for example, you feel like a little discomfort. It's the same thing. Here, you're also getting the numbing. So in the flu shot, you're not getting numbing, you're just getting the shot. Here, you're getting the numbing first. So a lot of people can't even tell, even if somebody says like, oh, I feel a little pressure. Most of the people like pressure, that's all. So put the needle in there, and under the camera, you get to see it. We aspirate the bone marrow. It's called bone marrow concentrate. So we aspirate that thing.
It's liquidy?
It's kind of a semi-liquid. If you look at the blood is pinkish, right? So the bone marrow is more maroon. So it's
Darker
a
blood.
little bit darker blood. It's much thicker because it's got all the ingredients we talked about compared to a blood. So it looks, I know you're getting scared, but don't not worry. It's not that bad at all. It's more graphic when we talk about it. So we take a good volume of the cells. Sometimes if I'm doing multiple joints, for example, if I'm doing this knee, I may take it from both sides. Or if I'm doing just one side, I'll get enough cells with a 60, 70 cc volume. We get that from bone marrow. So once it's done, all you will get is like a little bandage. That's it. There's no suturing because we didn't cut it. It's just a needle. Everything closes in, and the patient gets up and just go walk around, eat something, drink some fluids, kind of move around a little bit. So we'll have some downtime, like 2 to 3 hours. In that time, what we do is we separate the bone marrow concentrate. And as per the rules, we can separate it, not manipulate the cells. Government of India says like you can separate it. So we separate the cells and extract the cellular portion only. So even the marrow is this much, the cellular portion actually maybe, for example, if I'm doing your ACL treatment, I may get like 3 to 4 cc of the actual cell portion. So we get that thing. Then I put you under camera again, same day. You got to do the same day, right? So you're under the camera, we put some ultrasound guidance, we put some fluoroscopy guidance. So I'm able to visualize your torn area. So we numb it up a little bit on the, so you don't feel, you don't complain, you don't scream. So you're comfortable. You can watch it on TV as well. So with small needles, and we advance into the torn area so we can visualize what's going on. We confirm the placement because ACL could be a proximal tear, a distal tear, a mid-portion tear. And ACL has 2 bundles. So it's like 2 bundles. So anterior posterior bundle. The advantage of doing this procedure over surgery is when you do surgery cannot get your 2 bundles back. It will be only like 1 graft. And also your ACL has proprioceptors. That means that will tell you, hey, my balance and all those. When you do surgery, you lose that. That's the reason you see most of the ACL surgically repaired, almost a higher percentage, almost 50% re-tear within like 2 to 3 year period. You see all these athletes, most of our football guys. But unfortunately, if somebody has a huge tear, they have to go for surgery. But smaller tears like you don't need to go for surgery. You can repair it. So with the visualization, with the camera, so we go place the cells in the knee. So then we immobilize with not the big immobilizer, just the brace, the ACL brace with a little bit of, hinge right here. And that one day you do the crutches and you walk out without weight bearing or partial weight bearing. So you go home.
But does the injection hurt?
No, it's all numbed up, right? So you don't feel it. And the needle size is 25 gauge. 25 gauge is like your diabetic needle. So it's discomfort, like something poking, but not like pain. Pain is there when you cut everything, right? We're not cutting anything. We're just advancing, precisely going into the areas, visualizing it, placing the high concentration of cells, and then slightly immobilizing, sending you home. Then I bring you back the next day. The reason I bring you back the next day is, so we put the seeds in there, right? Then I need to water that. I need to fertilize that. So I need to activate the cells. So the next day we draw your blood. And with the blood, I get all these growth factors, the high concentration of platelet mix in there. So that we put it around that. We don't go in the graft or in the tear. We put it around so that your knee absorbs all this material. So that activates the stem cell growth or bone marrow aspirate growth, basically. Then you go home. 1 to 2 days, we tell you, hey, don't put too much weight on it. Use the crutches as needed. Wear the brace. Just get in the car, get out, and do minimal things. After 5 days, we will start physical therapy, the exercise program. Not high intensity. You're going to start with your own body weight, like slow intensity with your body weight, isometrics we call it. Kind of you're trying to build the VMO, we call it, the quads, the things that support your knee. More specific knee exercises. You start doing it either in the office or at home, wherever. So 1 week you do that, 2nd week you bump up. You go a little bit more weight. 3rd week you go up. So as come to a month and a half, you start feeling the strength is coming back and your confidence coming back, the stability coming back, and the pain getting back. Then you feel like, okay, I can get into, if you're a runner, you go into running, but it's too early for us to send you running after a month of this, right? So we start slowly. We may let you jog a little bit, do an elliptical. So we graded, advance it. So then I follow up again, or my team will follow up again. At that point, we do boost it one more time with a little bit more of the platelet mix.
The fertilizer.
Fertilizer again. Because by the time we expect you, you're reaching the second stage of more functional. So you're going to do more functional. After that point is when I'll kind of let you loose. Kind of, hey, examine, everything looks good, tight. Okay, let's go a little bit more movements. If you have an ACL tear, you're not going to go to sports in 2 months. In 3 months, you can go back to sports.
3 months after the stem cells.
Stem cell. We're talking high-level sports, like, but the recreational little things, you can do it. So exercises, you do it. Workouts, you do it. Gym, you do it. Only thing you don't do it is cutting, planting, jumping. Those you don't do it for 2 months. Changing direction that risks a re-injury, we will not do it. Most of the athletes, like that we treat, or non-athletes, around 3 months. Sometimes I may get a repeat MRI if the demand is more. If somebody needs to go back quickly, I'll look at it, looking good, we let you go. Sometimes I may not get an MRI that soon. I may get an MRI like 5-6 months later. With non-athlete, hey, I'm doing good. Hey, just get back, incorporate into your workouts. Okay. We do that thing.
Couple of questions.
Mm-hmm.
Firstly, we just spoke about knees in this case, but say if someone's got a shoulder injury, I don't know, what else, spine maybe?
Yeah.
Similar process.
Yeah, so same thing. For example, spine is a little different, but I'll tell you shoulder. Shoulder most commonly is like the rotator cuff tear.
Yeah.
Like, not able to lift it, sleeping. People can do this, but lifting, that means you have torn the rotator cuff. There's also something called a labrum, which is like that little layer, the cushion layer. You can tear that thing. It could be degeneration, wear and tear, working out in the gym, or like just sometimes even diabetic people can have it without any injury, or sports people also can have it. So anybody can have it. So that's one of the common thing. Similar process, right? So we aspirate the stem cells and image guided and inject precisely into those areas, rest it, slowly incorporate them back into their regular lives, basically.
Probably the timelines are slightly different.
Yeah. So for example, the knees and the shoulders, to a certain degree of hips, similar. Whereas when it comes to, there is a condition called AVN. You might have heard about it, called avascular necrosis of the hip. These days, since the COVID has come, in India, it has become like an epidemic. The reason is a lot of people during COVID were given steroid medications, to save some lives, right? Like everybody had like a Delta wave and all that. But steroid caused damage in the bone. So the blood supply in the bone disintegrates. So then the hip starts collapsing. We see that in younger people.
Hip starts collapsing?
Yeah. So if the hip is like a round, and imagine you lose the blood supply in there. So there is no support of structure, starts collapsing. So it starts with stage 1, 2, 3. When it comes to 4, it collapses. That's we're seeing a lot because of the mostly COVID. So that's a different kind of procedure. That procedure is, for example, in your case, we're injecting the connective tissue, soft tissue in the joint. But if it's AVN, we have to go in the bone, not in the joint. So we have to drill into the bone, put the cells in there, create that new blood supply again. So that thing requires like 1 night of hospitalization or 1 night of stay. So that's a little different recovery on that one. Same thing with the disc. Disc is also as an outpatient. I would say 99% of the hips, shoulders, knees, ankles are all outpatient procedures. Okay. There is a one case like this, we may have to keep overnight and observe the patient.
Okay. And in all those 99% cases, the pain levels are roughly bearable.
Very tolerable, very tolerable. To be honest, maybe disc may be a little bit more painful, but depending on the procedure, we kind of help that aspect as well, right? Like, for example, I'm anticipating pain from your disc procedure. we will give you pain medication to get you through that thing during that day. Most of the pains, seriously, if they have it, 24 hours. On the second day onwards, what happens is when we inject the bone marrow cells, we are creating inflammation. So I'm creating a healing response. So it's not like putting a medicine in there, right? So what it's doing, it's actually creating more of a swelling and inflammation before it starts healing. A lot of that heavy swelling inflammation lasts like 24 hours, and our body starts absorbing again. And by next day, they're feeling like, okay, it's not as bad. One night was uncomfortable. We give a couple pain medications. They expect that thing, they sleep, get through it. Next day, they feel good. Some people, even drive themselves. Yeah. Majority of these are outpatient, minimally painful, and never significant pain or anything like that.
Are there cases where the person's body doesn't respond to stem cell therapy for whatever reason?
It's unlikely. The reason is like the way we live, the way we are functioning, the way we are healing is through our stem cells only. There may be a condition where you have stem cell diseases, like, bone marrow diseases, very rare conditions, and they have defective stem cells. And those are the people that require bone marrow transplantations. Those cases may be, but as a healthy individual that's functioning, you will respond. The response does not depend on whether you have stem cells or not. The response depends on, are you a candidate? That means, are you coming stage 4 or stage 2? If you're a stage 4, you're not a candidate. We will not do it. There's no point. You're not going to get better. You need surgery. When it's stage 3, 2, 1, yes, you are a candidate. So that dictates who is a candidate, who is not a candidate. Not like whether we have cells. We all have cells. Our body lives. Even a 98-year-old person will have enough cells to help his own body. 15-year-old person will have it. So age group wise, we all have cells as long as we're living, and our cells are good enough to heal ourselves.
Costs, sir. Cost spectrum.
Costs vary depending on if we do a platelet procedures, much cheaper. Generally, I don't know, 20, 30,000, 40,000, could be 50,000, depending on the areas. The stem cells, newer technology, and so slightly little on the higher side. But compared to surgeries, maybe if surgeries are, I don't know, 3-4 lakhs, whatever, these could be 2-3 lakhs or less. So much less than surgeries. But we are anticipating as we go in, because some of these, I would say, kits extraction, we still bring from US. So the manufacturing process is not here. So it gets a little expensive, part of it, the centrifuges and all those. But once, I would say, as we have more and more acceptance and I think the cost will go even significantly. For example, in US, the surgery cost is almost 10-20 times more than a stem cell cost. If stem cell procedure, example, if you're doing a knee or shoulder, on an average cost $6,000 to $7,000, a knee replacement surgery costs $70,000 to $80,000. So here, hopefully, it will happen of that nature, but presently, it's still not too cheap either.
Yeah, it's like 60-70% of a
surgical cost, I would say. Okay. And some of the higher, like a bigger corporate hospitals, maybe even more expensive.
Yeah. The overarching point here is, I think there's a big price that one pays for surgery.
Yeah.
Which you only understand after you go through a surgery.
Right.
It's always better to try other means before you go in for the surgery. That's my opinion.
No, absolutely.
And of course, in saying that, if it's completely torn, if it's completely ruptured, you have to go for a surgery anyway.
Yeah.
But try exploring your options before you...
Exactly. So there are multiple advantages for that, right? So imagine you're trying to keep your own ligament. So biologically, you're intact. So you have certain ways, body has certain ways of moving, certain ways of sensing. So you're all there. Imagine you have a metal, you have an implant in there. So you have an artificial.
Yeah.
It may be good for a while. What if it wears out? Then what do you do later? So somebody who needs it needs it. There's nothing like nobody needs. People need surgeries for sure, but not everyone needs surgeries. Majority of them can benefit with these interventions.
Okay.
Yeah.
Have to bring this up. I have a dear friend, he's a cricketer, Krunal Pandya. He had some elbow issues and he had gone in for PRP in the UK and he showed me a video of his PRP.
Yeah.
I almost shat my pants.
Really? Yeah.
Because it seemed very painful from that video. He showed me that whole process.
Was he crying in the video?
Yes.
Okay. Yeah.
Because I mean, I'd love for you to explain how PRP works. And he said that that's probably the most physical pain he's felt in his life.
Oh, wow. Yeah, and he's a cricketer. He has had multiple injuries, I'm guessing. So that is not the standard in general, I would tell you. The reason if somebody is doing PRP outside India is because most of the PRP in India, when you say it's done in a centrifuge. You take your blood, you centrifuge it. Most of these commercial centrifuges that's sold in India that a practitioner can buy, they can do 3 to 4 times concentration. That means take your blood, you concentrate your platelets 3 to 4 times. Sometimes that is not enough. When you have a bigger injury or an older patient, we need to concentrate it to 16 to 18 times concentration. So it's not like 2 to 3 times is going to be fixing everybody. So there's a reason why these top athletes like to go outside and get it done, right? So same thing that what I do in Dallas, we do it in Mumbai and Hyderabad, same thing. We get that lab concentration. So we can go 16, 18 times. So that is the high concentration of platelets. So that's the concentration of the platelets. Injection part. So depends on the joint, the painfulness. If he's getting into the tendon, it is slightly painful because it's a tight structure right there. Anytime we go smaller joints, they're painful. The bigger joints are not as painful. But we don't have to let the patient go through the pain. There are ways we do it, right? We do it nerve block. If I'm doing an elbow, we do a nerve block prior to injecting the PRP or stem cells. Then you don't feel the pain. But if there is no nerve block done, yes, it can be very, very painful temporarily, even the 10 minutes. But that can be avoided. That can be avoided by doing a pre-block. But it depends on, if some clinic, oh no, it only takes 5 minutes, let's go do it. That's one thing. And some people say like, hey, let's do a nerve block. So that be comfortable when you get the procedure done. And once the procedure is done, most of the pain when we inject the tendons is while it's happening. It's not like late in the night. It's not like tomorrow when it's going in. So if we can make that experience better, say like, do a nerve block, the patient does not feel much, then you're under guidance, you look into it, inject it, patient can watch it, not feel the pain, and give like little pain medicine for that evening. The next day they're fine. Yeah. That can be easily done.
From everything that I've spoken to you and considering that video that he showed me of his PRP treatment, I think that stem cells is a lot less painful than the PRP.
I wouldn't say that because it is not the material that's painful. It is mostly the joint that's painful. For example, if I'm going into a smaller joint like this could be very painful because there's not enough space for the volume to go in and stretch it out. Imagine I'm going in the knee. It's a huge capsule, so you can put it and it's not as painful. It spreads out. Same thing in here. If I go in the disc, it could be painful, but the size of it. But as I said, you can mitigate that. You don't need to go through the pain because it's not like 10 days of pain, right? It's like 5-10 minutes of pain. So why don't we do, for example, if I'm injecting the thumb or the ankle, we do a ring block basically. That means you're numb, not like motor. You can still function. Sensory, you don't feel it. Then we inject the PRP. Then you don't feel it. You can watch it happily. And then you go home, a little discomfort. That can be easily done. But maybe in that institute at that time, because as I said, some people come and say like, Doc, I don't want any numbing. I'm tough. Go do it. Do it. Maybe they have done it in that fashion. But again, that can be easily mitigated because most of the things are done under nerve block anyhow. Yeah.
Are you comfortable naming some of your patients?
I've treated a lot of patients. Like there's an MMA champion, like he was one of the oldest, Guy Mesger. We treat that guy, and I've treated so many NFL guys that play for multiple teams, National Football League,
NBA?
basketball, NBA. So a lot of Dallas Mavericks players that I treat those. So a lot of recreational athletes, college, high school athletes that are going into the next level, like a couple Olympic athletes as well, the runners that ran with Usain Bolt on that 200 meter. So there are a lot of them because, as I said, like my basic training was sports medicine. So all I did was sports medicine. And that's how I came into this field, because this was done in sports people first, and then it has become available to everybody else.
Without taking names, have cricketers come to you?
Yes. Yeah.
What role in the team?
What they're doing. So I've treated bowlers, and I've treated batsmen as well. The bowlers, I would say that one of them is like a big rotator cuff injury, like a fast bowler. The other one was like more of a knee. It's called basically he has got like a little hole in the knee, basically from previous surgery. So we have to go in there. It's called a necrosis situation, where we go in and like do a micro trauma ourselves with the needle and inject the stem cells back into that. So, and I also have a bunch of players that have like low back issues, the hyperarching low back issues. And I see some of the techniques of our current cricketers. I know, if you don't mind, like Jasprit Bumrah, one of our greatest bowlers, I always worry like the hyperarching and the hyperextension. I always worry, is he going to go under? But again, these guys are well-conditioned athletes. They get a lot of support. I'm just saying, I do see certain mechanisms can be like weightlifters, for example, doing like the deadlift. And I've seen like when their technique is wrong, I'm really worried like this guy is going to, burst his disc out, or like doing overheads. Some dancers have a lot of ankle issues. Certain sports have inherent risk of that. Basketball guys always come with the jumper's knee and like patellar tendonitis and the cartilage loss. So sport has thing, but certain sports have certain different kind of injury risk, basically.
Okay. Bumrah's also got sick genetics too. Like, help him out.
Oh, man, he's helping India like crazy. He's like our treasure, right? Like, I mean, I want him to do whatever he's doing. Please do it. But if you have anything, do not ignore it. Just let's get it treated at an early stage. But he's got a good team, BCCI and NCA. I mean, they're all in good hands.
I also think he was out for a year and a half ish recently. And that was very much needed for him, because then he won us the World Cup in 2024.
Absolutely. I think Shami is going through similar injury and having trouble getting back on track. I'm not familiar with the exact details of it.
I mean, the little that I understand about cricket, I've just figured that if someone's a fast bowler, they're going to need that little 1 year break, 1.5 year break at some point over the course of a 15-year career.
Yeah, I'm sure. Yeah, because, the loads are tremendous. See, the load they do compared to a batsman versus on a bowler, you're literally stretching every joint. I mean, you're not only talking about the shoulder, you're hyperarching your back as well, and you're hyperextending your knee. So injuries are prone to happen. And even though there's no injury, a repetitive use can also be creating some wear and tear, and that can show up after a few years. So these are the kind of conditions that you don't wait till it becomes a big issue. You just treat them early stage. Imagine, like, for example, you've seen these footballers, right? Like the Ronaldos, Messis. How many years they've been playing? They've been playing for 20 years of football, and they play around the year. And football is not like, chess, right? Like, it's physical. There are injuries. You see these guys ever going down for a year or two, you rarely see them. The reason is in Europe and India, in US, the regenerative medicine, all these guys, like Ronaldo's, all these guys have their cells stored. They literally hit these things every off season.
Wow.
Every off season, you hit these joints. Even our patients, like when we go to Cayman Islands in US also, we have a lot of our athletes. They come every off season. This is proactive. That
Damn.
means they're good, but they want to be at that 100% level. So it's a proactively maintaining it so that the injury does not happen. So that's because they're elite. And that's their life, and the teams need them. It's millions of dollars if they don't make it. That's one way of protecting your body and taking care of it.
Yeah. I mean, we talk about ice baths being a good practice to do regularly.
Yeah.
This is like the ice bath that you take once a year.
Yeah, no, absolutely. Yeah. But, again, for a non-athlete, I would say athlete is elite athlete, professional athlete, we don't need to do repetitively. But somebody like them, that's their life. And so that's their career. So we got to keep him up to full potential.
So you're saying the top athletes like LeBron James, Ronaldo, Messi, these guys have stored their stem cells somewhere in the world, and every off season they'll get their joints injected.
Yeah, majority of them. For example, you cannot store in US, as I mentioned. In Europe, there are few areas you can store it. You cannot store in India. You cannot do that. So, as I said, even in Cayman Islands, we have a facility. There we have a lot of our NFL professional guys. They store their cells. So that the advantage of storing the cells versus you getting a procedure. For you, like in India or there is, we have to take the bone marrow, inject on the same day. It's allowed. But I cannot keep your cells. I cannot grow them. I cannot save them. That's against the rules, basically. In those countries, you can do it. So the advantage, for example, storing your cells is you have ACL, you do great. You come back like a year later, doc, something happened to me here. Or like something happened to me here. I don't need to go back and aspirate the marrow again, get the cells again. All you need to do is, hey, when are you coming in? Your cells are already here. So let's get him ready. You just come in, just an inject and go. That's the convenience. And also, those countries, you can actually multiply the cells. So instead of doing one joint, they may come and do 4 or 5 joints.
Wow.
It's like a stem cell makeover. Basically, you see that thing.
How do you multiply the cells?
So you can actually grow the cells in a medium, in a lab, in a cryopreserved state.
Like they grow like fungus?
No. See, cells, the normal way of cell functioning is like multiplying, right? Each one multiplies into. So you just multiply them. So, but you save them in a cryopreservative. And then whenever you're ready, say like you're coming next week. So there's a 10-day period. Then you start taking the cells out. And then you start feeding them with the necessary. And then they start multiplying.
Gotcha.
So instead of having, I'll just give you an example. Like say like, I need 25 million cells for one joint. But now I'm doing 3 joints. What do? You just multiply. You take more times to get those to 75 million so you can hit all 3 joints at one time. But again, we're talking something it's not available in US or here, but for the purpose, like something like that is so convenient for all these elite athletes.
Gotcha.
Yeah.
Wow. Which European countries?
Which European countries? There are some like in Germany, they can do it. Not the main institutes, but there are under Korea, the people do it. A lot of South American countries, Panama, Cayman Islands, Mexico. So there's a lot of down south below our US, a lot of those, because these are really small countries with very, easy regulations. So good and bad, right? Good is, yes, responsible guys doing research for 20 years, everything protocol based, showing it to the government, what we're doing and all those, benefiting the patients. But imagine you lax the rule. How do we know who is real, who is doing what, who is going to control? So there is always a negative side to it. So that's why countries like, US and India, we don't allow that quickly until you can monitor all these activities. So these small countries are able to do that.
How do you spot a negative facility?
For example, an institution like ours, right? So we started here a few years ago, and I'm telling you, like, okay, these are the things we're doing. How will you believe me if I say, like, oh, I'm going to cure this, I'm going to cure this? That does not make me like support what I'm saying, right? I have to have a supporting evidence behind that. For example, you're asking about an ACL. I know we were talking about ACL, but any joint, for example. So this has been done for like 15 years, right? As an organizational, we have started the research. We have thousands and thousands of patients that we followed and studied, and we published studies on it, and we followed the patient data on it. And so you collect all the data, and now we know, hey, we have done like 2,000, 20,000 patients, and this is the evidence that we are getting. There is no side effects. We have followed these patients for 10, 12, 14 years. So I am saying with the evidence, and not only in our institute, Dr. Hernego in France did the same thing. So all this community of regenerative orthopedics throughout the world have concurred that this study shows there is growth, it's safety. Then we're doing it. Same way we brought it to India with all these things. Similarly, like we have provided all this data to the governmental sources, and you have to get permission from them, even for bone marrow. You can't just do it. So we have to get permissions from them, like, hey, this is the protocols we're doing. These are the labs, and we're not culturing the cells. We're within the guidelines. So then that procedure has evidence behind what I'm saying. So it's evidence-based medicine. Right. So that is not proven. The outside countries, what you're talking about. If somebody comes in and say, like, I'm doing this thing, let's go, come here, do it. That person has not done any research, has not published anything. In these countries, they cannot do it because you got to prove it. In those countries where the rules are lax, they can do it. There's no FDA there, so nobody's going to control those. So that's why it could be bad actors.
Effectively, as a consumer, you've got to do a lot of research on the facility that you're visiting. You have to figure out the past track record.
Absolutely, because these are new procedures. Right? There is a lot of negative talk outside. The surgical community say, like, oh, doesn't work. And whereas the progressive communities, no, this is working miracles, whatever. So when we say something as physicians, our responsibility is just let's not say something. Let's prove it, then talk about it. So do the research, see who has been in this field, see who has been published literature for years, who has been doing patient data, or who has published in the articles, and who has been in the research. So once you have that, then because these people worked on it. Not only these people, like this community, basically, international community. So that's very important.
So either you do this detailed research, or you just call Cristiano, LeBron, and say, hey guys, where do you guys go?
Where do you guys go? Yeah. Exactly. I mean, they wouldn't go to anybody. They will come. So, I mean, like I have few of the colleagues that we worked on, but they know, they do their research. They're not going to put their bodies on somebody who's claiming to be good, right? Gotcha. They check you out, everything. Hey, okay, safe, done, track record. Let's go here.
You said that these top elite athletes, they might just do the stem cell extraction once, store the cells, allow them to multiply in the facility, and then every off season they'll come back and they'll get their joints injected based on where they're feeling a niggle, right?
Correct. Yeah. That's or like, most of them have image guidance, right? Like, we do ultrasounds, we do scans and MRI scans, and we know like what's going on with the patient.
You're able to spot the degeneration in their bodies through scans.
Absolutely, because you cannot guess anymore. Okay. Yeah, you have to look into it and find out what exactly is going on.
Is there any downside to the stem cell extraction?
No, because as I said, two things, right? One is it's your own cells, so there's no, there's no negative side effects. Number two is it's done as a procedure, not as a surgery. That means you're doing with a needle. So when the needle goes in, it goes through the skin. So skin becomes a barrier for infection or anything. So you go in and you're coming back and you're closing it. Yeah. So the infection is not an issue there.
I think the question is coming from the place of why don't these guys just get that extraction done every time versus get it once and stored? I'm assuming it's because you all grow the stem cells also in those facilities.
Yeah. So the reason is two things, right? One, you're making multiple visits for that rather than you just coming in and going.
Okay.
Number two, you cannot multiply with one extraction. So if you already have it, and you can multiply as many as you want. Number three, you're getting old, but your cells are not getting old. So you still have, say like, you gave your cells like when you're 18, 20, when you go into your career, and then you're 35, you're still playing. But again, as I said, the cell age does not matter, but still you have potent cells. Or if you're going through some kind of a disease now, then you can't do it. At least you have your things.
Wow.
Just like we're talking about how an umbilical cord, how kids were saving, athletes do the same thing as well. Yeah.
Okay.
Yeah.
What a fun episode this is.
Yeah. No, I mean, like, it's amazing. Like these guys, LeBron, I have not treated LeBron, but, the agent, and we have some common clients, spends, I may be quoting wrong or right, minimum of $2 million a year on his regenerative stuff. Because the guy still can keep up with the rookies that are 18-year-olds right now. And he's pushing 40. It's amazing. He's playing with his own son at the same time. How many athletes have that much longevity?
Yeah. To give the audience context, because a lot of Indian audiences do not watch NBA, LeBron James is 1984 born, which means he's 40 years old.
Yeah,
But he's still playing like one of the top 10 guys.
absolutely.
And he's been the number one guy for the majority of the last 15 years. This is the end of his career, but he's still in the top 10 players.
Yeah, yeah.
You remember in like 2005-ish, Sachin Tendulkar had also got a tennis elbow?
Yeah, I heard, and he went to, I think at the time, to England and got the injection done.
He had got stem cell therapy?
I'm not sure what he got, but injection means it's got to be either PRP or stem cell at that point. I'm sure he's had other injuries as well, but usually when you go outside and get an injection, you don't go and get a steroid injection in a different country. You usually get one of these two. Yeah.
So he must have got perhaps PRP back in 2005-ish.
At that point, yeah. I
Okay.
would say
Okay. Now coming to the more everyday part of this podcast. Up till now it was only stem cells.
Yeah.
This is going to be the more relatable section of the podcast.
Okay.
So I would love for you to make the answers very short and crispy, because there's a lot of people my age with a lot of random joint, muscle and bone problems.
So quick fire.
Yeah. So let's begin with a simple question for you. When it comes to people who go to the gym, as an orthopedic doctor, what are some exercises that you would avoid?
So basically 3 things, very simple. Overhead, heavy. I mean, you can go stretch, but no military press, number 1. Number 2, crunches, avoid it. Number 3, deadlifts.
Okay, gotcha. So I'd probably replace the military press because it's for the anterior delts with just front raises.
Yeah, or bend down. You can go bend down, raise it rather than overhead.
Gotcha.
Yeah.
The crunch I would replace with planks.
Planks, bridges. Yeah,
very good for core
you can do that thing. Yeah.
And the deadlifts, I would probably replace with those lower back exercises, like a reverse.
Yeah, you can do that, or like seated glute extension. So you can do multiple things. The reason is I see more injuries than benefits with the deadlift. If you're really well trained, have a good muscle balance, do it. But if you're trying to get better, that's one thing you may want to avoid because the risk of injury is very high.
Yeah, I think here we're not talking to the nerd gymmers.
Yeah,
we're talking to the people who just want to stay healthy.
Exactly. There's so many other exercises you can compensate without doing these things.
Gotcha.
Yeah.
Okay. Next question. Considering that most of our spines are degrading because we're sitting down most of the times at the office.
Right.
That's a whole generation. What can you do to degrade the degradation of your spine?
So, number 1 starts not in the office, outside the office. So you got to work on your core. and abdominal as well as back exercises, because that's what dictates whether you're going to sit upright or not, right? Number one. Number two is like ergonomic, which I don't need to tell, everybody talks about it, like ergonomic arrangement of your computer or sitting and all those. Lumbar pillow as well. Plenty of hydration, because that keeps your muscles not get fatigued, tired. And periodic breaks. You just get up, walk. And even simple things like when you're sitting and if you have a little bit of a foot rest, that takes the pressure off your lumbar spine versus sitting like this versus just a little bit of foot rest. And I sit on a ball in my office. Like, I don't sit on a chair because ball will force me to sit upright. So when I'm upright, I'm engaging my core.
You're talking about Bosu ball?
Yeah, not Bosu ball, the big exercise ball, like a big 75 millimeter exercise ball. So I'm automatically doing my exercise while working.
Your core is engaged.
Core is engaged. So I'm not doing this. I'm not doing that.
Wow.
I'm not saying do that, but that's something that I learned. It works great for me because I do have back problem as well. So I would say do all these things and then work beyond the office, like, go back and work on your core, planks, bridges. Then you can avoid or prevent a lot of these conditions.
You're a really fit guy.
I try. Yeah, I try.
How old are you, if you don't mind me asking?
I'm like 58. I'm
what
old.
The fuck?
Yeah, you can cut that, but I'm old. Yeah.
You don't look your age at all.
I know. I hear that thing. Yeah.
What?
I hear that. No, seriously. Yeah, I am. Yeah. Yeah, I take care of myself. Yeah.
I thought you were like 39, 40.
No. I take care of myself. Yeah.
Are you serious?
I'm an old guy. Yeah, I'm an old guy.
What have you done to look so young?
No, I mean, like, it's, some you got to bless with some genes. That's number one, right?
You're Telugu?
I'm Telugu. Yeah.
Gotcha.
Yeah. Yeah. Number two is like, you got to take care of yourself. Right? Like, so your eating has to be good. Your lifestyle has to be good. Then you work out regularly as you is. And you got to be lucky not to have any diseases or anything that puts you down. So when you have all these things and have a good disciplined life, you can age, you can beat the age, and you can be healthy, you can be happy, which is what I promote as well to people to do those. And I have to practice myself as well.
I'm shocked. You know what I'm visualizing?
Yeah.
I'm visualizing you pulling out stem cells, injecting them on your face and your muscles.
I think that's coming slowly. Yeah. Yeah.
Oh, really?
No, the face and stuff. Yeah. People are working on all those things. The hair, all those things are happening. Yeah.
I have a friend. We actually did a spectacular episode recently. His name is Farb.
Okay.
And Indian audiences didn't lap up that episode initially.
Yeah. Okay.
He spoke a lot about biohacking in general.
Biohacking.
It's becoming a big wave in the US.
Yes. Yeah.
He spoke about injecting follistatin into the muscles.
Yeah.
Do you want to talk about that a little bit?
Yeah, I mean, not that particular technology, but the biohacking, basically. Yeah, I mean, not only US, I'm sure like a lot of people little bit following that thing or wanting to do that thing.
Okay. It's becoming a...
Yeah, I mean, it's a double-edged sword. You have to understand, that's the industry. It's not regulated. That means, are you getting the right information sometimes? Or are you getting the wrong information? There is no, like, as I said, like in our industry, FDA controls, right? You can say, do whatever. In that industry, yes, it's good. But you also have to be careful. Are you getting the wrong information? If somebody tells you to eat this, sleep, and don't sleep, or starve yourself, and if somebody's saying the opposite, one may have negative effects of it. So it has to do their research. It has to be accepted by other people. But it is a good thing. It is definitely a good thing. So you're basically helping your body, like manipulating your body to your advantage, and manipulating in a good way, and not in a bad way, to your own advantage. Like you're working with your genetics, you're working with your biology, your neurology, your sleep patterns, your diet, right? That means, number one, the good thing is, you are trying to improve yourself. That's the number one goal that everybody needs to have. Hey, I want to feel good. I want to have energy. I want to look good. I want to be productive, right? If you have that thing, you'll do the right things. And so these are modalities, biohacking, whatever, nutrition, fasting, products, supplements. I'm sure like, your guests have spoken and you're familiar with all that. I don't need to expand on that. But stem cells is a big part of biohacking, the regenerative biohacking, because most of these, if you've seen the biohackers, they will go inject proactively, like, say, like, you're having, okay, my joint is getting worn out, 50, whatever. Okay, I want to be like this next 10 years, 15 years. So you go proactively inject to create that cellular healing, because we get a cellular senescence. That means our cells start dying, and then your body starts repairing, and that capability decreases every decade, right? So I'm getting older every year, so I don't repair as much as like when you are 20 years old. But now with this method, we're injecting, helping with your own cells, obviously, and you're able to beat that thing. So that's how, like, cellular senescence can be stopped with stem cells as well.
Okay. How expensive is it to store stem cells?
So it could be dependent on which country you're doing. It is really not that expensive.
Really?
I mean, when I say not that expensive, is somebody who can afford to have these procedures. But if you consider the Western cost, it is expensive. It could be like anywhere from $10,000 to $20,000
a year.
For a 10-year plan, 20-year plan, like that. Yeah,
that's
yeah. But depending on the country, depending on where you're doing that kind of stuff. So since I don't do it myself, so I'm not really familiar with the pricing. But I remember it was in that range. Yeah.
Wow. So
yeah.
You said up to $20,000. I'm assuming you're talking about a good facility and everything, which means 2s are 16 lakhs in total for 20 years, which means about 80,000 rupees a year, roughly.
Yeah, I mean, it could be much more expensive depending on the institute you're going. And yeah, I mean, like, it's not outrageous if somebody is really trying to get better. Like, particularly as I was telling, like, these professional athletes, that's nothing for them.
I mean, a membership to a great club in Mumbai is a lot more expensive than that.
Yeah.
Like, it's probably 3 lakh, 4 lakh rupees a year.
Yeah.
Versus spending about $1 lakh or 2 storing your stem cells for a period of 2 decades.
Yeah.
Not bad.
Yeah. But again, as I said, like, it's happening in countries where there is not much of a regulatory controls. So you got to be very, very careful when you think about those things. Gotcha. You got to know who is credible. So all those factors have to be in place in order to think about that. Yeah.
The bad boys are still going to go for it.
Yeah, exactly. They will. Yeah, they will. Yeah.
Okay.
Yeah.
More rapid fire questions.
Yes, sir.
Arthritis.
Mm-hmm.
I think it's one of the most common problems in India, especially when it comes to aging women.
Correct.
I think the protocol at this point is a lot of women visit a knee doctor when they have pain, and the knee doctor gauges the level of pain, gauges the level of degradation, and then tells them whether to go for surgery or to go for preventive care. Right? Can they come to a doctor like yourself who's more about regenerative therapy? And if yes, then how does arthritis get healed through stem cell therapy?
So arthritis, by definition, is you losing the soft tissue between the bones, right? Like, say, like we're talking about knee. So you have the bones, and once you start losing the cartilage, which is like a cushion, like our carpet, like a rubber, meniscus, when you start losing, we lose as we age, or we lose with injuries as well. So as you go thinner, then the pain gets worse, your function is decreased, you have a lot of pain, and you're getting bone on bone. So that means it is a little too late. That's called stage 4 arthritis. Patients cannot walk. So those patients need knee replacement. So it's a fact that needs to be done, so they have to go. But arthritis never starts with stage 4. Arthritis always starts like somebody like 40s, 50s, 60s with small pain, meniscus injury, or like some internal injury creates imbalance in your knee. Then you start wearing out. The next year it gets worse and the cartilage goes down. Next year gets worse. So you start at 1, go to 2, go to 3, 4 is when you get the surgery. But all these years, we didn't have in between treatments like what we are talking, right? We didn't have biologic treatments. We didn't have bone marrow cells. We didn't have platelets. So people used to exercise, diet, and restrict their lifestyle, not to go anywhere. Go to 4, do it. But stage 3, 2, 1 have tremendous advantage if we can address them at this stage. Like, for example, the stage 3 or 2, that means you're moderately degenerated. We inject the cells into them and they say like, hey, I'm 70-80% better and I'm able to exercise, I'm able to enjoy my life. Then you don't go to stage 4 anymore. So you don't need that surgery, so you can avoid it. Even better if I can get at stage 1 and 2. So the faster you recognize, the faster you feel like there's something going on. We examine, we x-ray you, we MRI scan you, we find out. Don't wait till like, oh, I'll come when it's too bad. When it's too bad means you're letting the stages go. So 1, 2, 3 absolutely can benefit. And to a point, you can get excellent results early. You can get good results even late, not too late.
Gotcha. Okay.
I'm sorry, I was not fast.
That's fine.
Answering
That's fine.
That thing.
This is it's an important piece of this podcast because it's a very common problem.
Right. Yeah.
Another very common problem that we see in India, I see this with a lot of girls. They've got neck and cervical issues.
It's because most of the cervical conditions, like we call it spondylosis, like disc, nerves, facets, ligaments, right? Any kind of neck pain you see in both sexes, but mostly in women. And again, when you say only neck, it almost never happens only neck. The spine is one unit. It goes from here to there, right? If you have a bad neck, you're going to compensate with your back or your thoracic spine. So, or if you have a bad back, you can have the same problem. So they go hand in hand. So when we evaluate a spine, you always have to evaluate the whole structure. How are your mechanics? But that is very true. You see that a lot in women. Yeah.
I think it manifests in women my age as not being able to move your neck, having a lot of shoulder pain, etc., etc. Again, could they opt for stem cell therapy?
Yeah. Well, not everyone needs stem cell therapy. Say like if you're dealing with the facets, ligaments, wear and tear, tendinitis, or sometimes, as I said, the muscles can be atrophied. Sometimes the high concentration of platelets is good enough. You do not need, some people have this radiating pain, the numbness and stuff. A lot of times we do just a high concentration of platelets and prolotherapy in that area, and they improve a lot.
Gotcha.
You only need stem cells when your discs are getting degenerated or you have severe arthritic changes, then you need stem cells.
But whatever we spoke about are the early signs of the disc getting degenerated, right?
Yes. Yeah.
So if you have this chronic kind of pain in a particular region, take care of it.
Take care of it, yeah.
Life has taught me something that I'm going to repeat. I've already said this on the show. Life has taught me that if you are in any kind of fitness, go find yourself a sports physio at the age of 25 or 26.
Correct.
They'll help you with your posture. They'll help you with your core strength. They'll help you with exercises that you have never heard about or never thought about.
Yeah.
You won't believe that those kind of exercises exist.
Yeah.
And it's been a game changer for me.
Absolutely.
And I'm from a doctor's family, so I know the value of doctors as well.
Yeah.
But sports physio is trained to help you stay fit in the long term.
Absolutely. And also physically, he can see you, how you're doing, what your form is while you're doing. So it's very important. Some good trainers are also there, but also bad trainers. So be careful. As you said, the sports physios are more medically oriented, so they know the conditions. So absolutely, it's a combined big ecosystem. In order to have a healthy you got to have somebody who can guide you. What are the proper ways of moving, exercising, and all those. Gotcha. When you have injuries, we're there. But when you're working out, they're there. So it's when you follow all these, and as you take ownership of yourself, eat the right food, and have good disciplinary lifestyle, you'll achieve your goals. Yeah.
Before we let you go today, sir, I've got to ask you about some more really popular general wellness-based therapies that are becoming popular in America. What's usually the trend is that what becomes popular in the West becomes popular in India 5 years later.
Right.
lymphatic drainage has started to become big in India. I think
Yes.
that's something your facility also offers.
Yes.
Right?
Yes. Yeah.
It's been very useful for me getting a
Mhm.
lymphatic drainage massage regularly.
Got it.
It's changed a lot for me.
Mhm.
Are you a fan of it?
No, yeah, absolutely, absolutely.
Okay.
Yeah, yeah. Any age group. I mean, like it's so we all have a lot of accumulation of particularly in the lower extremities. Older people, you got heavy legs. A lot of people complain about it. So draining those things effectively will improve. Not only the circulation, your energy levels and everything. That's an absolutely one of the modalities we use in wellness for athletes, non-athletes, older people, everybody.
Gotcha.
Yeah.
What's another hyper popular wellness therapy in America?
In America and also in India nowadays. So one of the things you might have heard about HBOT, hyperbaric oxygen therapy, right? So that was used mainly for like certain medical conditions, or somebody like going underwater sea when they're coming up, they're kind of the pressures are different. So you put them in a hyperbaric chamber for a few days and bring them out. Just like same thing, the space guys come in. So on a daily basis, like we breathe our oxygen and we don't get the 100% oxygen, right? Like so, but imagine like if you're in a chamber where it's pressurized and have 100% oxygen going into you, imagine the benefits you're going to have. Tremendous benefits. It's going to go in, improve your circulation, heal the wounds, heal the inflammation, improve the skin, and so many other benefits. So that has become like, hey, can we do this in a portable form? Can we make it into a smaller form? So that's been the new thing in US and even in India nowadays as well.
You can create a hyperbaric oxygen chamber at home.
Yeah, not you can create. You can obviously buy a commercial product.
Okay.
So the homes are not as effective because you're talking about like trying to contain the oxygen in a plastic material. So there are big enough commercial models that you can put in a clinic setup. So most of the wellness centers in US have those things.
Gotcha.
So you go in, so you lie down for like 40 minutes to an hour. And then you'll be given that 100% oxygen. And then you do that thing, couple times a week or one time a week along with your weight training and your other modalities. And people have seen like tremendous benefits of healing. You see a lot of celebrities doing that for their skin health and their recovery. You see a lot of athletes doing that. And nowadays we see a lot of older people trying to get the improvements coming. So that has become pretty common in US. Now we have introduced in India as well. So we're seeing great benefits with that.
How expensive is it?
So you're not buying the whole tank, and so you go in and get it done. It could be anywhere. I know we're talking prices. Usually we don't, but people need to know. On an average, around 5,000 rupees for like a session to 6,000. So I think that's an average price. With the high level, there's a 1 liter, 2 liter oxygen therapy. So the good commercial level oxygen therapies would cost that much. So that's an average price. Yeah.
Gotcha. Do you feel high when you do it?
No. It's oxygen. It's oxygen. You feel great when you do it. There are a few conditions, like when you have like a severe lung disease, you're not supposed to get into that thing. But most of the times it's like going into a CT or MRI machine, so you don't feel any other thing other than just like you're breathing oxygen. And again, you come out and you're not going to tell like great improvements right away. It's helping you over a period of time. So you will see that freshness. You're able to sleep better. You're able to feel your inflammation is better. You remember you said like the cryotherapy, the going into the water, same thing, right? It's creating healing on the inflammation. These things give multiple benefits. And a lot of diseases, people with the autism, people with the diabetic ulcers unhealed, even those people can get tremendous benefit with that.
Gotcha.
Yeah, along with the regular people with wellness.
How does your head feel when you do it?
I don't think that's that much, but if somebody has an inner ear infection or something, they may feel like a ringing in the ears.
No. I'm saying like, do you feel lightheaded?
No. There will be. Yeah, it's just like any other room. Like you're in this room, but it's a smaller room.
Okay.
But you're getting more oxygen than what we're breathing right now. So we don't,
Understood.
because imagine like you get 100% oxygen going into your blood supply, and all your red blood cells are getting that higher oxygen. So that's what we're creating in that chamber.
Okay.
Yeah.
What other therapies are coming through in the West right now?
So the cryotherapy is already, it's been in India in few places. That's one thing. The red light therapies, so infrared saunas, where you can improve the skin tone as well as collagen formation. So a lot of people that want to, look good, improve their skin texture, they use those things. Lymphatic drainage, you can have the lower extremity or even like the entire body suits basically. So you can have the whole body suit, and it gives pulsations and pushes the lymphatic back into the system. So people dramatically feel like they lost some weight because everything going back into the blood circulation. Right. And so those are all wellness therapies.
For the audiences, I'm just going to give a quick context on what lymphatic drainage is. You have lymph nodes in your body.
Yes.
You have a lymphatic system in your body. And as you just keep living life, assume that this lymphatic system gets overloaded by your body's own internal pollution in a way.
Correct.
Fair to say?
Yeah, absolutely.
And you understand this after you get your first lymphatic drainage massage, where they basically squeeze your lymph nodes. It kind of releases a little bit of lymphatic fluid, and then they brush it down to the extremities of your body. At the end of your whole lymphatic drainage massage, and your lymph nodes are right from inside your mouth to like near your shoulders, to your hamstring, your calves. When they finish doing that entire lymphatic drainage, you feel high, honestly.
You do? Okay.
You feel very lightheaded.
Yeah.
And they ask you to drink a lot of water on that day.
Yes.
So that you're able to just excrete all your toxins. Also, some people get reactions sometimes. You get a fever, you get a cold maybe. But again, this is just your body letting go of the toxins.
Yeah.
And it's been very, very, very effective for me.
For you? Okay.
Yeah.
No, yeah, that's the same purpose. Like as you age also, some people, so your blood vessels lose the elasticity, right? So it cannot pump. Because sometimes it can pump by itself and everything goes into, your blood supply and you excrete and everything is gone. But sometimes when you age, why people have these fat legs, and as we age, because you lose that elasticity. So everything kind of stagnates. So having these massages, and you're talking about like a manual massage, somebody doing it, but there are suits that we can wear. You wear like a compression suits and they automatically do it. So you're in that suit for like half an hour and you get all your lymphatic drainage. You feel much lighter and you're improving your circulation. So that's also wellness modality as well.
That's a great purchase in my eyes.
There you go. Yeah, there you go.
Okay.
Yeah.
We're almost at the end of this episode. So I was waiting for someone to appear on the show and speak about stem cells mainly and all these associated treatments.
Yeah.
So I had a blast today. Before I let you go, because we're talking about something that's medical.
Yeah.
You're dealing with people's bodies, people's lives here.
Right.
Do you want to give us some signing off notes related to just precautions? Because lots of people are pumped about stem cell therapy after listening to this episode.
Right. Yeah. So one thing people need to understand, stem cell therapy is not the same. Every stem cell therapy is not the same. So we have to talk about what a country allows you to do. For example, in India, so there's a higher body, regulatory body called ICMR and Government of India. They allow us to extract these material from your bone marrow only. And they will not allow you to culture or grow the stem cells. So nobody should do that. So when we do that thing, we need to obtain the permissions from the ICMR. So that means they have qualified you to do this, and they also give you permission to do more research about stem cell culturing, growth in other conditions as well. So that body controls these things. So when we say stem cells, we're talking about bone marrow aspirate and the aspirate contents, and there will be some stem cells, some growth factors, cytokines, everything in there. So all that thing in one word, we call it like stem cells, just for understanding purposes. So that body controls the whole thing. So we have to make sure, like when somebody's got to make sure, hey, do we have the necessary permissions? Are you doing it the way what your government allows you to do. So that's a person's job to find out. So, and we like that kind of regulation, so that way the proper growth will happen.
Gotcha.
Yeah.
Research on your doctor,
Yeah.
research on the institute that you're going to, and truly understand stem cells in detail before going for stem cell therapies.
Absolutely.
Okay.
Yeah.
So
Yeah.
this was a lot of fun.
Yeah.
Thank you for being on the show.
Me too. I had a lot of fun too. Yeah.
Oh,
I'm
glad.
hungry, but I don't feel hungry anymore. Yeah.
No.
Yeah.
Sorry for
It's
keeping
good,
you
like-
hungry, but it's just your aura that kept this episode going.
No, awesome. You make it so easy.
Thank you,
like,
sir.
so it's good to know, like, you have so much knowledge about this thing. So
Oh.
it just flew.
Thank you.
Time
So
flew.
honestly,
Yeah.
I'm very excited that this option is available in India now, because we have read about stem cell therapies for the last 10 years. We know that American athletes, European athletes have access to it.
Right.
It's finally reached our country.
Yeah.
And there's a lot of people like me, my age,
Yeah.
who want to kind of pamper themselves for the sake of their old age. That's how I look at this therapy. This is why we work hard and earn money.
Exactly. Look, imagine the next generation. Like, they don't have to wait till something goes bad. So now you're preventing. So imagine like how they will have almost half the conditions we'll have, because you're going to treat them so early. Yeah.
Oh, thank you, sir. Really
Yeah,
appreciate
yeah.
it. Glad to have
Yeah.
met you in life.
Yeah. Same here.
Thank you.
Yeah. Take
Thank you,
care
Dom.
now. Yeah.
That was the episode for today, ladies and gentlemen. There's very few episodes where if someone asks me, hey, how was that particular conversation? I go, oh my God, just brilliant. That's how I felt about this conversation. I'm sure you feel that way at this point. I'm a geek when it comes to biohacking, biology, these kind of topics. But you need the right people. You need the right qualified professionals to teach you about topics like stem cells. So, couple of requests. The first request is to share this video with your friends, especially those of you who are above the age of 30. I think it's our phase to begin some kind of biohacking. And the second request is to suggest guests related to this kind of a topic. Lots more topics related to gene editing, gene-based research, stem cell-based research, the future of medicine are going to come up on TRS. Stay tuned. The biology geeking has only just begun, but first, go show your support to our Indian superstar who's killing it in international waters as well. Dr. Venkatesh will link all his social media handles down below. Always support Indians making India proud on the world stage. This was Dr. Venkatesh on TRS, and I promise you he's going to be back soon. I hope you enjoyed today's episode.